So again, how should we measure the UK government's success or failure in the face of this crisis? Well, the Scotland Office Minister, Douglas Ross, joins us on the line this morning. Good morning to you. I wonder, when you hear that death toll and look at the figures, can you honestly say that the government's strategy has been the right one?
Look, and good morning, Laura, and it's very difficult for everyone in the country to hear figures of 20,000 and more deaths as a result of COVID-19. Sir Patrick Vallance was very clear when he made that statement a number of weeks ago that it was also very difficult to pin down the exact number of deaths we will face as a country. But it is important.
Can you pin down the exact number of deaths? Because that number at the moment, which is almost 21,000, is hospitals alone.
Yeah, and no one can. No scientist, no politician, no individual can pin down the exact number of deaths that will be caused in the United Kingdom by COVID-19. But I have to say, and you would expect me to say this, that one death alone is a family that is in mourning, friends that have lost loved ones. And for us to be over 20,000 is a terrible loss for this country. And our thoughts are with every single family who is suffering at this time due to the loss of a loved one, of a friend, of a mother, a father, a brother, a sister from COVID-19.
But is that not why we should be looking at the actual figures as opposed to just the hospital deaths? Because there could be twice as many deaths in the community. In the community, some statisticians are saying that it's probably sitting at just over 40,000. Even if you take a rough guide from the Scottish figures, about a third of the deaths in Scotland are in care homes.
Yeah, and we are looking also in England and Wales at these figures as well. There'll be more analysis of those figures in England and Wales later on this week. What we have said, Scottish Government and UK Government have said, is it is easier and more reliable to have figures from hospitals than it is in the wider sector, but it is something we're looking at. We're not trying to hide these figures. It's just more difficult to give reliable, consistent figures out with a hospital setting. But a death, whether in hospital, in a care home or at home, is a loved one who has been lost, and we have to recognise it's not simply just a number, it's a story behind every one of these cases. And we
Do you think the strategy that the UK government has followed has been the right one?
I think it's a strategy that the UK government, along with every devolved administration in the United Kingdom, has followed based on the science. And it's important that we listen to the scientific advice, we adapt as that changes, but we give the NHS the best opportunity to fight this killer. And that is done by ensuring that the capacity in our hospitals is not breached. And what we have seen by the measures taken by the UK government, the Scottish government, the Northern Ireland Assembly, the Welsh administration, has ensured that people have listened to the advice. They have stayed at home, and the reason these figures are not higher than they are is because the public in Scotland and across the United Kingdom have taken on board this advice, have seen they can play their part, and they have done so by keeping these figures down, by ensuring we don't breach that capacity in the NHS.
You mentioned there that you've been following, the UK government has been following the science. Professor Hugh Pennington, who's well known across the country, suggests ministers are using that line to shield themselves so they can't be blamed if things go wrong, because the scientists are coming up with different scenarios all the time.
No, I don't think anyone's using it at any level across the world to try and shield themselves from any criticism. There will understandably be mistakes that have been made and will continue to be made across the world fighting this virus, a virus that we didn't know about just over 100 days ago. But I think it's also reassuring for the public to know this doesn't get down to petty point scoring between political parties. This is driven by the science and the advice we are getting in the four nations of the United Kingdom and across the world. And I think it's important that the public are reassured that yes, there will be divergence in views amongst scientists. That will always happen. But we listen to the best scientific advice to try and make the best choices for people across the country.
Dominic Cummings on the Scientific Advisory Group for Emergencies, is he there to listen, or is he there to make points? Why is he there?
Well, he's not on the group, but the same with every administration. It makes sense that advisors to the most senior politicians hear the advice that is being given at SAGE and at other expert advisory groups. And I think that's been recognised by politicians across parties and previous government advisors. I think it would be strange if the senior government advisors didn't listen in to the advice that their ministers were getting.
OK. The Prime Minister obviously back to work this morning. What's first on his agenda? Will it be publishing lockdown strategy?
Well, we've already published our 5 key tests as to how we get out of the current restrictions. But the Prime Minister is getting straight back into work. As you said in your news report earlier, he's chairing a committee of Cabinet colleagues today. I think it's really good. We saw a large amount of support for the Prime Minister as he was taken into hospital. There was clearly a lot of concern when he went into intensive care, but he's recovered due to the great assistance and support he received from the NHS. And I also think it's important, I was just going to say it's important, whether it's the Prime Minister recovering from this terrible virus and leaving hospital, or 98-year-old Daphne Shah, as we heard from Scotland a couple of weeks ago, these are stories that tell people, the positive side of this, that people get through this.
And there was a lot of support.
The Prime Minister is,
there was a lot of support for the Prime Minister then, but it now looks like the UK government is very much behind the Scottish and Welsh government, and the Prime Minister is under increasing pressure to lift lockdown.
Well, I don't think anyone can say we're behind the Scottish and Welsh government, given that the Scottish government, I think, would accept themselves. The 26-page document that they released last week is based on the 5 key tests that the UK government had developed and announced several days earlier. Nicola Sturgeon said yesterday her document is still evolving, and it is evolving around the 5 key tests that have been laid out by the UK government. We have set out our plans at a UK level, which have been replicated in Scotland and the other administrations. There is no greater information about how we will leave these restrictions in Scotland as there are from the UK government. The Scottish advice has been based on what the UK government have said.
And we're running out of time, so just one final question. Brexit's going to need to be delayed, isn't it?
No, it's set down in legislation that will leave at the end of this year, the transition period, and the fact that we have that definite date to work towards, I'm sure will allow us to get these negotiations done and completed, and we will leave the European Union and the transition period at the end of this year.
Douglas Ross, Scotland Office Minister, many thanks indeed for your time this morning. Just after 8:10 this morning, we will be speaking to the Health Minister, Jeane Freeman.
Well, over the weekend, the Health Secretary, Jeane Freeman, unveiled plans to ramp up the testing and tracing regime here in Scotland. And Jeane Freeman joins us now. Good morning to you.
Good morning.
What difference when it comes to testing will we notice this week?
Well, a couple of the things we'll notice this week is, excuse me, first of all, we will meet the target we set to increase our testing capacity in NHS labs to 3,500 a day. And we will also begin to see not only the drive-through centres, which people are perhaps now a bit more familiar with, but also we are part of the key worker app testing that allows employers or key workers to book slots at those drive centres, and the mobile units which we have seen rolled out south of the border will, in conjunction with our health boards, begin to appear in Scotland, and that does allow ease of access for testing for people for whom those drive-throughs are perhaps a bit far away.
There'll be 5 units in place, I gather, quickly, another 8 up and running in the coming weeks. In terms of covering the whole of Scotland, that's still not very many. I mean, at what point will they all be operational, firstly?
Well, it's not clear yet at what point all of them will be operational, because we have to work that through with both the UK government and, of course, the Army itself about resourcing that and making sure that the tests that they take, the samples they take, can very quickly get to the lab. And that will be the new lab at Queen Elizabeth campus that is being run by Glasgow University. Of course, all our health boards now have their own testing capacity that has increased significantly. And we know there is, this is not the end of the story, because in order to do the test, trace and isolate, which will be a central part of any easing of restrictions that are decided upon, we need to continue to ramp up the testing capacity, but also the lab capacity and, of course, the important tracing exercise.
Just on these mobile units, are they specifically going to be visiting care homes?
No, our care homes are not at this point. That doesn't mean that won't be the case, but our care homes testing is undertaken by health boards. And as you know, last week I announced that we would extend the testing in care homes to all admissions, as well as those being discharged from hospital where they have been a COVID patient. The individuals in those cases need to give 2 negative tests before they are discharged to wherever it is they are going.
Just explain to us where these mobile units will actually be based then, and will they work in the same way as the large units that we've seen, like at Glasgow Airport, for instance? Will they be set up on that kind of basis?
Well, they are mobile, so they will go to wherever it is, initially in the south of the country and in our Highlands, but we need more than that. Of course, you know as well as I do that the Highlands of Scotland, even NHS Highland, covers a significant geographical area. So this is the beginning of that mobilisation, and they will be there to allow key worker testing in particular, but to supplement any other testing that is needed to feed into our NHS labs.
So they'll be in a different place on any given day. People will be told to, if they need the test, to come along to them.
Yeah, the logistics of it, of course, are being worked through very carefully to ensure that, as you'll know, Scotland has quite a big landmass, but in those areas, the population is dispersed amongst that. So we need to hit on the best locations for them to pause so that people can access it more easily.
You're using the same language as the UK government when you're talking about capacity for 3,500 tests a day. Do you expect all of those tests to be used every day?
So we do, because I think we're seeing the capacity that we have. So the 3,500 is separate from what we've just been talking about in terms of those mobile units. The 3,500, we do expect that to be used because we are seeing the capacity increasingly used, and we know that as we move into test, trace and isolate, that there will be more testing being done. Your previous contributor from Edinburgh University was really clear about what that exercise involves and the fact that it is long-term. It's not a one-off exercise, it's a scaling up of what we were doing in the early phases of our response in the containment phase.
But the reality is, as you've just explained to us, we're still working out the logistical details of some of this. The World Health Organization has been saying test, test, test for quite some time. Do you accept, when we look at countries like South Korea and Germany, where they've had a lower death rate than we've seen here, that ultimately you've just been too slow on this issue of testing?
So when we first started in dealing with the pandemic, Gary, in terms of laboratory capacity, we had 2 labs in Scotland that could, between them, test 350 samples a day. Now, we have gone in a very short period of time to that 3,500, plus what we are talking about, you and I, in terms of those mobile units. And we have made those decisions based, as others have said, on the scientific and clinical advice available to us and then applying judgment to that. Undoubtedly, when we are eventually through this pandemic, there will be questions and an inquiry looking at all the decisions that all the governments in the UK took and whether or not at the time, with what they had in front of them, those were the right decisions. But right now, what we are doing is working according to that advice that we've received, applying our judgment and getting ready for the significant test, trace and isolate exercise that we need to undertake as we consider what restrictions it may be possible to ease in whatever way at whatever point.
Well, to that end, as you say, this is the way forward, this is the way of moving us out of lockdown. Is a capacity of 3,500 tests a day enough for that phase?
No, as I think I said earlier in our
Well, how many will we need then?
We will be increasing that, and we've asked our own Scottish Scientific Advisory Group, led by Professor Andrew Morris, forgive me, who works alongside SAGE, to give us to do the modelling work. They're working their way through that to give us an indication of what they think by the time we are confident. Because remember, at this point, although the numbers are beginning to stabilise and show a downward trend, we're not yet at this point where we are confident we can ease the restrictions. So as we move through that, they will do, excuse me, the modelling, and that will give us an indication from them about the numbers of tests that they think we should be trying
But
deliver every day.
if it's taken us a couple of months to get up to this point, and you accept that this point is not enough, we'll need more, then could it potentially take several more months to get to the point where we actually can operate this system fully?
No, it won't, because I think I said at the outset that we will reach our initial target of 3,500 by the end of this month, and the word initial is important. But we know that we need to do more, and the work is underway to do more. But as the First Minister and I have always said, we're not going to give you answers to questions when we don't yet know those answers. It's really important for your listeners that what they hear me say, they can rely on. So as soon as I am confident about the increase in testing capacity that we will be meeting, in addition to the participation we have in that four-nation programme, then I'll happily give you that number.
On the issue of releasing some of the restrictions, you mentioned Professor Linda Bald that we spoke to after 7 o'clock this morning, a public health expert from Edinburgh University. We talked about face masks and the fact that Germany is lifting restrictions, but it will be compulsory for people to wear face masks. I think she said 40 countries had now brought in similar measures. Do you see face masks as being one of the tools at your disposal that you will need to deploy to lift the restrictions?
So I think the important thing, is to make a distinction between face masks as we see them in a health and social care setting, either the very important ICU level face mask or the fluid-resistant mask that other staff use.
Yeah, I was talking specifically about people wearing them day to day as they go about their business.
And face coverings. And there is a degree of evidence that shows that wearing face coverings protects others from you. So if I was to wear a face covering, for example, when I went for that emergency or that essential shop, then if I coughed or sneezed, that would protect anyone near me from me and what I might emit by coughing or sneezing. So the First Minister, I think last week in one of our daily media briefings said that she had asked for that group led by Professor Andrew Morris to give us some advice on that. They will be looking at the evidence that Linda spoke about, and that advice will come to us, and when we're clear about that, then we will make that clear to the population in Scotland.
One of the things that we saw yesterday at the UK briefing, when they show you those slides about traffic use, was that traffic numbers seem to be creeping up. Is there now evidence, do you believe, that the public are beginning to lose some patience with these social restrictions?
So I think that the first and the most important thing to say is that I think people in Scotland have been absolutely incredible in how they have complied with those restrictions. And it does get harder every single day, and especially when our weather warms up and it looks very enticing to be outside. I haven't seen yet the latest figures from Transport Scotland. But once we do see those, we look at those regularly, that will give us an indication as to whether traffic levels have increased. We're not seeing an increase that I'm aware of in public transport or in people gathering in more than their own household, and I think Police Scotland would confirm that. But whether or not traffic is increasing yet, I haven't seen the figures that would tell me that it has. But I do understand that it is getting harder for everyone every single day that we're asking them to do this, and all the more reason for me and others to be very grateful to them for that, because we can see that it is working. We can see that our NHS capacity is not overwhelmed. We are not in the situation that we've seen elsewhere in Europe, or even at one point where London looked as if it was seriously going to be overwhelmed by the number of cases. So what everyone is doing every single day is truly making a difference to protecting our NHS, and because of that, to saving lives.
Jeane Freeman, Health Secretary, thank you very much for your time once again this morning.